Hello and welcome to Community Service Spotlight. I'm your host, Bud Kwok, and today we have Emerson Goodwin from KentuckyCare. So stay tuned, we'll be right back. I'm here with Emerson Goodwin, and he is the Corporate Regional Director. Got that right?
You got it right.
For KentuckyCare. And this is going to be good because I really don't know what KentuckyCare does. I got an idea, I think, and we're going to get into that. What does KentuckyCare do?
Well, Bud, thank you for asking that question. We are a series of medical clinics. So we have doctors, nurse practitioners, nurses, and we provide primary care for our patients. So if people have flu, if they have sore throat, if they had, like I had earlier this week, they had a sinus infection, they have more significant issues, more chronic disease issues, we can see them. If they have diabetes, we can take care of that. As a matter of fact, a partnership that we have with Four Rivers Behavioral Health, we begin to have folks come in and get issues like depression addressed in our medical clinics. We just recently started a medically assisted therapy program for folks that are trying to battle opioid addiction. We also just added registered dietitians, so we're going to be able to look at the nutritional needs for folks that are looking at the issues that nutrition plays into our health. And so we provide a lot of services, but it's primary care for moms, dads, and their children. And I thought we covered almost everything right there. That's That's a lot.
That's a lot.
We have a drive-through pharmacy, so I didn't get it all.
A drive-through pharmacy.
Drive-through pharmacy, yeah, at our Midtown clinic. Yeah.
Okay, well, I thought, low-income patients, but that's not true either.
Well, actually, our mission is health for all. So all means, regardless of their insurance status or their income, we can see them. So if there's folks that don't have insurance, we can see them, and based on their income, we'll put them on a sliding scale. We're not free, but we'll put them on a sliding scale.
Yeah.
We can see people with Medicaid. So in Kentucky, we have 5 managed care organizations that manage Medicaid, and we can see folks in any one of those Medicaids, or we can see Medicare or commercial. The high-level commercial insurance, we can see them too. And I believe that if folks were to come to our clinic, they will see that they're in just as nice, probably nicer facilities than they've been where they're going now. So it's health for all.
Yeah, yeah. So you have a number of doctors who have patients that's their primary doctor.
Yes. We're the primary care provider for over 20,000 patients in the last 5 years.
And if you needed a specialist or something else, they would refer?
Yes, we refer to specialists when need be, yes.
So you don't need a referral to come to you, though? You just walk in or call? Or
walk in, call. We encourage people to call because just like when you go to a restaurant, right. You can walk into any restaurant, but if you go in a popular restaurant, if you don't call, you find yourself behind people that have already called. So we take appointments and we take walk-ins, but it's a delicate balance on how to make that work.
And this may be a question we weren't ready for, but how many doctors do you have? A number of doctors, or do they work at KentuckyCare and also work at another office, or how's that set up?
Okay, we have in the Purchase region right now we have 4 medical clinics. And we're going to have our 5th in Graves County in Mayfield in April.
Just in the Purchase area here?
Yeah, just in the Purchase area. We're working primarily in the Purchase area. Our short-term vision is that we're going to have a medical clinic physically in each of the 8 counties. And right now, we have 2 MDs and we have 3 advanced practice nurse practitioners. Mm-hmm. We are in the process of bringing on a 3rd MD, and we're always looking for quality talent, so we can continue to grow.
Are you open like all day in each location, or?
Monday through Friday, 8 to 5 in all of our clinics. And then in Midtown Clinic at 125 South 20th Street, they have additional hours on Saturday, 8 to noon, as well as the pharmacy is 8 to noon. And our pharmacy is located at the Midtown Clinic, right off of Kentucky Avenue.
Okay, well, you said this is primary care.
Yes.
And you covered a little bit of the services already, but can you go into more detail on the different kind of services you provide? I know you need shots if you have a sore throat, if you got a cold.
Yeah, we're the place to come.
Okay.
Come see us. We can take care of you.
If you think you got heart problems, is that the place to start?
Well, if you're concerned that you may have some heart issues, you should start with your primary care. But if you're having a heart incident, you should go to the ER.
Yeah.
Okay,
911.
Yeah, 911. Let's be clear about that. But if you're concerned about you haven't been to a doctor in a while and you want to get checked out, you want to have a physical, we're the place to come for that. And what we see in our work with Lourdes and Baptist is they refer a lot of patients to us after folks leave the hospitals, because that hospital stay is to get you through an event. We're there to walk alongside you and help you monitor and manage whatever health condition that you're working with.
Okay.
Okay.
Yeah. And if you need, say if you, I keep talking about hearts because I've had some heart dealings already, but say you thought you might need something like that, would KentuckyCare be a good place to start because you refer to other?
Yes, we refer to other specialists. So we would be the place, and then those specialists would refer you back to us for your continuing care.
Yeah. Okay.
Okay.
Yeah.
So we're like to medicine. What we like to say is we're like the front door. Unfortunately, a lot of folks have been using, because there's not been, we're medically underserved, there's not been a lot of practitioners in there. People will go to the emergency room. They get great care in the emergency room, but it's very expensive. It's the most expensive care you can get. If it's not an emergent issue, you should come to a primary care office.
Yeah, that's got worse and worse over the years. I know back when insurance, like for instance, the place I worked, 100% coverage. You didn't have to pay a penny. Well, every time you had a little thing went wrong, you went to the emergency room because it was free. You know, but then as that's morphed into, okay, you're going to pay your part now. You thought that it would get away from that, but still, a lot of people, I'm
well,
aware.
if folks don't have an option, they're likely to go to the emergency room if they've not established a relationship with the primary care office. And that's why we've been working really hard over the last 4 years to help people understand who we are as a provider, as doctors' offices, if you will, and help them know that so they can come see us or other providers and not go to the emergency room. Because to go to the emergency room, if it's not emergent, if it's not an urgent issue, it's going to just cost them too much money.
Yes, it is. And I know it sounds crazy, but there's a lot of people out there that don't have what used to be called a family doctor or primary care or what have you. I don't know which way we're going to head here now with the new administration on that type of insurance and stuff.
I don't know either. There's been a lot of studies that show that primary care, folks involved in primary care need to go to the emergency room in hospitals less, that they receive better care with a family doctor. So there's been a lot of emphasis on how we're going to encourage people to go to a family practice versus the higher expense somewhere else. And you're right, we don't know what the new administration is going to do. We'll have to wait and see. But the good news is KentuckyCare, we have 5 years of now entering our 5th year of history here in Kentucky. Our corporate office is in Augusta, Arkansas. In Arkansas, we have 30 years of history. So we were here before there was the Affordable Care Act. We're going to be here long after the Affordable Care Act. We'll just have to see how we have to manage our business.
Yeah, when I first heard the KentuckyCare, I thought, well, that is part of the Affordable Care Act, which everybody calls Obamacare, but and I think he likes that name. But
it is interesting. I'm relatively new to the area myself, and that was a question we got a lot. Is this an Obamacare clinic? and I would always respond with, there's never been an Obamacare clinic, so no, we're not. We see people that have received insurance through the Affordable Care Act, and I guess, well, not a guess, I know we'll see people, no matter what the new iteration, the replace and repeal is going to be. We just, our big effort is how we help people know who we are and what we do, and then encourage people to take the steps that they need to take. Yeah. Because health really exists between doctor visits. Okay, your health is not dependent on that day you go to the doctor. It depends on what you do between the time you go to the doctor, trip A to trip B. Right? Yeah. What are you doing? Are you getting physical activity in every day? Okay. Right. Are you trying to cut back the things you love to eat that you know aren't good for you? I'm going to make a confession full on TV now. One of my favorite foods. I know. One of my favorite foods is fried chicken. Yeah. Okay. I'm going to have to slow down how much of that I eat because, as we know, fried things aren't as good for us as fresh food. So I can have grilled, I guess.
A boiled chicken's not any good. I've tried that before. Boiled,
grilled.
Oriental food.
I like grilled.
A lot of times the chicken's not. They're boiled till they're done. They're done. They're cooked, but they just don't have that good. I applaud you for going on TV because now you're stuck.
People see me with fried chicken.
Everybody sees you say, "Hey, you can't order that."
Oh, you said you can. I'm cutting back. I just said cut it out. I'm cutting back.
Cutting back. Yeah. So. Well, let's break away from that for a second to give your contact information for the viewers. And if you don't have a pencil and paper ready, we're going to give this contact information again at the end of our show. But telephone.
Because we have a number of clinics, I won't try to give you all the numbers.
Okay.
But we do have a universal number, so it's 1-844-KY-CARE-1. So 1-844-KY-CARE-1. And from there, you can get connected to a clinic close to you.
Yeah, and 844 is all I got to remember then, really.
Yeah, 844-KY-CARE-1.
Yeah. So you have a website also?
We have a website. It's KentuckyCare.net.
And
we have a Facebook page.
Oh, okay.
I'm not a major Facebooker, but we have a Facebook page.
You've got to be. Sooner or later, you got to
try to communicate with people that way, let them know about our services. And
just type in KY Care at the top of the Facebook page.
Well, yeah.
Don't even have to spell Kentucky, probably.
Well, we encourage you to spell out Kentucky Care.
Oh, okay.
Yeah. We don't know what you'll find out if you just plug in KY.
Okay, in McCracken County.
Yes.
Where's the physical location at?
In McCracken County, we have two clinics.
Okay.
We have our Midtown Clinic at 125 South 20th Street at the corner of Kentucky Avenue in South 20th. Okay. And also on the south side of town, in front of the Walmart on Irving Cobb, it's 3420 Irving Cobb.
In front of the Walmart. In front of the Walmart.
Yeah.
Well, there's a lot of stuff out there. You got to really look.
Yeah. Well, as you turn, it's one of the major entrances as you turn into Walmart.
Yeah.
We're right there at the corner there.
And you can walk in or call.
You can walk in or call. We encourage you to call.
1-844.
That's right.
I already got it memorized, and I'm terrible.
KY-CARE.1. I mean 1.
Okay. And your other locations are in Western Kentucky?
So we started in Kentucky. I like to refer to it as the birthplace of Kentucky Care.
Yeah.
Is in Carlisle County in Bardwell. And then our newest clinic is in Ballard County in Barlow.
Barlow, okay,
Yes.
Yeah. Barlow, people don't know about Barlow. Barlow is still up and running. They've got a lot of industry there.
Yeah.
That they've had for a long time. You think, well, you drive through there, so well, this town's dying. When that's not.
No,
it's doing okay.
And great people there.
Yeah.
And I'm fortunate to represent our great staff at Kentucky Care. I mean, they do a great job. They really care about the patients and their needs, and they go out of their way to take care of one another and take care of the patient.
So you skip around to different locations and spend some time at each one of them, probably?
Yes.
Yeah.
On a weekly basis, we get around and touch base and see how we're doing.
Yeah. Well, you get one in Mayfield, and that's where I went to school. So
Yeah, we're excited about starting in Mayfield. About the second week in April, it should be up and running.
Yeah.
It's going to be at 8th and Water Street in the former Grace Community Clinic.
I know exactly where that is. Yeah. See, Mayfield, and I'll put a plug in for them. They're number 5 in the nation. Mayfield is in football wins, high school football wins.
Really?
Number 5 in the nation. Paducah Tillman's in the top 10 too.
I didn't know that.
Male, there's 3 Kentucky schools. Male's in the top 10 also. Yeah, you're in football heaven here. Don't tell anybody. Okay. You already said something about your home office, or your headquarters, or whatever you call it.
Augusta, Arkansas, home office.
You call it a headquarters or
I'll refer to it as the home office.
Okay. Okay, and that's in Arkansas. And do you have other locations besides Kentucky, or is that?
No. Kentucky is the first state that we moved to outside of Arkansas.
Okay,
and it's a very interesting story how we got here. The hero of the story is our Carlisle County Judge Executive Greg Terry.
Yeah.
He was in a Delta Regional leadership class and happened to be in this leadership class with our Chief Financial Officer, T.J. Whitehead, and they struck up a conversation, and Judge Terry basically was saying, when I was growing up in Carlisle County, there were 4 physicians we had an opportunity to go to, and now there's no one. And over a course of time, that discussion got to be, surely has to be someone there serving, and actually there was no one. TJ, our Chief Financial Officer, and our Chief Executive Officer started having conversations over time with Judge Terry, led all the way to Governor Beshear's, we opened in January 2012 in Carlisle County, and so that started our journey here. And it just because Greg Terry was going, listen, can't you all come over here and provide health services for our people like you do in Arkansas? Yeah. When there's nobody here, and after we examined it, there was not a federally qualified health center, and that's the long drawn-out name for the type of clinic that we are.
Okay. Well, in rural Kentucky, and I guess maybe a lot of places in rural America, used to have their doctors. Right. And I can name you some. I know Wycliffe. I think they have one right now, but they don't stay long. As soon as they find a higher paying job, and they move on. And that's with a lot of jobs, but doctors especially, I guess. And Wycliffe, most of the time, doesn't have a doctor either, Wycliffe.
Well, for medical clinics to be successful, like a lot of other businesses, they need a certain size population. And as communities struggle with keeping their population, that gets to be difficult for them to keep that service there. So we're glad to be able to come in to a county like Carlisle, about 4,500 residents, and provide what we think is top quality healthcare services.
And you say it's life-saving. It is life-saving.
Absolutely.
If you got to travel an hour and a half to get to a hospital or to a doctor, or even an hour. And I've had a gentleman of mine that wants to move from Paducah to Wycliffe, and he needs medical attention all the time. And I said, that's not a good idea. Even if there's a doctor there, there's no facility. He's traveling around, or he's in a little small place with no equipment or whatever. So yeah, it is life-saving. Do you have a goal or a mission statement or something that I've got?
Well, our mission, very simple: health for all. That's the mission.
Yeah.
Of KentuckyCare.
Easy. That's the easy
health
one.
For all.
I can remember that one.
Yeah. See.
Yeah.
And what good is a mission if you can't remember it? But anyway, health for all, and our vision, we touched on a little bit, is to have a clinic physically in each of the 8 counties of the Purchase region. That, as we grow, when Graves County comes on, we'll be in 4 counties. We'll have 4 more to go. The idea is to provide access. People can have access to a doctor, but they don't have to drive 45 minutes to an hour. Here in Paducah, you don't have to do that. You can get to a doctor in probably 15, 20 minutes almost anywhere in Paducah, but other places in the Purchase region, that's not the case.
Okay. Now, do you need volunteers, or are you strictly non-volunteer, or is there? Well,
all our medical services are provided by paid professionals. So there's no volunteer healthcare providers in KentuckyCare. Okay. All our providers, what we could use volunteer help with is some of our community initiatives, because we have a big heart for the community. For instance, coming up in April is our KentuckyCare Shoe-In for Kids. It'll be the 3rd year doing it. Now we can use volunteers helping us accumulate new athletic shoes for children in need and getting those distributed.
I heard about that.
We've
That's
worked,
great.
yeah, we've had an opportunity to work with a number of supporters here, raising those funds to do that. Western Kentucky Allied Services helps distribute those shoes for us. So we can use some volunteers there. I think we're looking for some volunteers to help us do some of the shopping, because a lot of people contribute, and then we have to go buy the shoes and to distribute to the young people. So we need some volunteer shoppers.
Well, that's the fun part.
Yeah,
They
yeah.
just shop and give it to
Yeah,
the kids.
yeah.
The hard part is finding people but it sounds like you don't have that problem but you could always use more though, probably, I'm sure, on
Yeah,
donations.
And I was talking about our big heart for the community. We've given out more than 1,000 turkeys in and around Christmas or Thanksgiving. So 1,500 shoes distributed, 1,000 turkeys. Those are our initiatives. And then we sponsor some items in the community too, like the Empty Bowls Project. We just love the
That's a great
whole
one.
dynamics of how that program works. You volunteer to glaze or throw a bowl, or you come to the event, and then you're contributing to help feed another family. So we love that event. So we sponsor that event each year.
Another plug, my stepmother Annie is big into that. She in Graves County. Yeah,
Okay.
she spends a lot of time. That's one of her favorite.
Right.
Is the bowls. Right. Yeah. She does a bunch of things, but that's her favorite. Yeah. And you do all these things in the community, and they're not cheap or free. You know, you can't give away 1,000 turkeys and just because you want to do it. So, are you financed through any programs or anything, or are you just a strictly for-profit business, or?
No, we're nonprofit.
Nonprofit.
Yeah, we're nonprofit, and we sustain through fees from charges for patients, because we're not free, and we're also sustained because we can write to the federal government for grants to offset our operating costs.
Okay.
Okay, so that's what the federally qualified health center piece is, that we can write for grants. And to be able to participate in that, you have to be willing to see everybody. So that's why we said this is our mission, to see everybody.
Yeah.
Is to make health care available to folks that don't have insurance, to folks that have insurance. I knew I was in the right place when I heard our CEO stand up in a meeting and ask the question, who do we serve? And the answer came back in unison, the least, the last, and the lost. And when I heard that, a note went off in my heart. I went, okay, I'm at the right place.
Yeah.
Okay. Depending on your faith tradition, that means all of us.
Yeah. Well, that was my next question was, how did you get involved in this? And you've kind of led us up to that, but
yeah, I was living in Bentonville, Arkansas, and our corporate office had a relationship with a nonprofit in Siloam Springs, Arkansas, called Bridges to Wellness, and they needed help. And I ended up being hired as the executive director and worked with RCare, which is our corporate office name, and they served on the board there. And that's when I got to hear the executive say, our CEO say, we're here to serve the least, the last, and the lost. And I knew I was in the right place. And at the same time I was working in Siloam, they were opening this office here in Kentucky. And then they kept mentioning, we need boots on the ground in Kentucky. We need boots on the ground in Kentucky.
Boots on the ground.
And one day after I realized that my daughters are grown, one married and moved out, one moved to Chicago to pursue her dreams and goals, I looked at my wife and says, we could be boots on the ground in Kentucky. Let's go over there and see. And so we came over, fell in love with the KentuckyCare staff. They're great people with big hearts. And the people of Paducah are so warm and friendly. We thought, man, we could see ourselves living here. And so now it's been 2.5 years, and 5 years for KentuckyCare, 2.5 years for my family. And we're just enjoying it.
Yeah. So you're not moving on anywhere.
This is it for me.
This is it for you.
God willing. I don't know what He has in store, but
Yeah. Do you have any great stories about people you've helped over the years, or?
Yeah, we do. We do have some great stories. Matter of fact, one recently, I told you we just started with our program where we're helping people that may have diabetes and chronic care. Well, part of the challenge with diabetes is you need to be able to check your blood sugar Depending on where you are in your progression in that disease, you have to do it multiple times during the day. Well, we had a patient who was struggling to get access to a meter, a glucometer that she needed, and the information, the strips and everything that she needed. Her insurance wasn't going to cover it. So we found out about it. We had her come in to see our registered dietitian, and through our program there, we were able to provide her all the supplies that she needed. We were able to teach her how to manage her diabetes. Her diabetes is now under control, and it had been out of control for a month and a half. And so we're real excited about being able to offer her not only the education, but the supplies that she needed to manage her diabetes.
You know, there are certain populations out there that have to make that decision every day.
Yeah.
You know, they have food for my kids, or transportation, or whatever that is, or can I go ahead and try to get the medicine that I need? And it's a terrible, I think Obama tried to get something started, and hopefully the Congress, I know they're going to change it or make a big change. I just hope they continue on so people will have a chance to make sure that they don't have to make that decision anymore.
Yeah, and here in Western Kentucky, we have a lot of individuals that are struggling financially, and they need the support of knowing that they can see a doctor when they need care.
Yeah.
That they don't have to make the choice between, am I going to be able to go to the doctor, or am I going to put food on the table?
Yeah.
Because going to the doctor is always going to fall down on that list until it gets to be an emergent issue. And that's when we see it's always better in health to catch things early than late.
Yes. Yeah. Yeah. Okay. Well, let's have your contact information again for
All
our video. Your
It's
telephone.
very simple.
Okay.
It's 1-844-KY-CARE-1. 1-844-KY-CARE-1. And our internet is KentuckyCare.net.
And your location here in McCracken County is?
125 South 20th Street at the corner of Kentucky Avenue.
Okay.
Okay, get on Kentucky Avenue. We got big banners on the building, can't miss it. And then on the south side of town is right in front of the Walmart on Irving Cobb, 3240 Irving Cobb. You can't miss it.
I'm going to say those two easy locations to find.
They should be.
Yeah. Well, Emerson, I want to thank you for coming in today and straightening all this out with me and telling everybody what you offer. And I want to thank all our viewers for tuning in to Community Service Spotlight. Until next time, thank you.